Side effects from peptides should not be ignored, but they should also not be dismissed as random. Sometimes a side effect is the body giving you a clue. Let's talk about side effects from peptide use through the Praxis lens. Because this is one of the areas where people tend to make two mistakes. One group acts like peptides are harmless because they are natural or because the body uses peptide signals already. Too simplistic. The other group acts like any side effect means the peptide is different, it's wrong, or should never have been considered. That's also too simplistic. The Praxis lens sits in the middle. A side effect is not something to ignore, but it's also not meaningless. Sometimes a side effect is information. Sometimes it tells you the dose is too high. Sometimes it tells you the timing is wrong. Sometimes it tells you the person's system is not ready. Sometimes it tells you the peptide is pushing the correct pathway, but the body cannot tolerate the downstream response yet. And sometimes it tells you that you're looking at the wrong pattern. That's why peptide medicine needs more than just protocols. It needs interpretation. A peptide is a signal. And when you put a signal into the body responds based on the system receiving that signal. That is the key here. Same peptide, different person, different terrain, different response, different meaning. One person uses a peptide and feels better. Another uses the same peptide and feels anxious. Another gets flushy. Another gets nausea. Another gets fatigue. Another gets insomnia. Another one gets itchy. Another one gets menstrual changes. Another gets a gut flare. The question should not only be, is this good or bad? The better question is, what does this response reveal about the system? That is the Praxis approach. Pattern, signal, system, evidence, risk, monitoring, and decision. Let's take a simple example. Someone starts a repair peptide and suddenly gets more itchy, flushy, congestion, skin reactivity, or histamine type response. I don't want to immediately dismiss that as random. That may be a clue. Maybe the person says mast cell reactivity. Maybe the immune system's already primed. Maybe the gut barrier is part of the pattern. Maybe the peptide is interacting with the repair inflammatory loop that was already unstable. Maybe the person does not need more repair signal first. Maybe they need immune regulation, histamine stabilization, barrier support, or a different sequencing strategy. That's a very different interpretation. A side effect did not just say, this peptide is bad. It said, look deeper. Another example, if a patient starts a peptide and sleep gets worse, maybe the peptide is stimulating. Maybe the timing is wrong. Maybe the dose is too high. Maybe the nervous system is already overactivated. Maybe the person is tired but wired and cannot tolerate additional signaling yet. Maybe they need autonomic balance before tissue signaling. Again, the side effect becomes a clue. Let's do another example. If a person starts a metabolic peptide and gets severe nausea, constipation, reflux, or food aversions, the answer isn't always just push through. And it's not always never use this again. The Praxis question is, what system is struggling? Is it gastric emptying too slow for the meal size? Is protein intake too low? Is hydration poor? Is constipation building? Is bile flow an issue? Is the dose escalation too fast? Is the person losing muscle? Is this expected adjustment or is it a warning sign? That is the difference between protocol medicine and pattern medicine. Side effects can clarify the pattern, but only if we are paying attention. This is especially important because peptide side effects can show up in systems people do not expect. A peptide aimed at tissue repair may reveal an immune pattern. A metabolic peptide may reveal a gut motility pattern. A neuropeptide may reveal an anxiety or sleep pattern. A hormone axis peptide may reveal insulin resistance. An immune peptide may reveal infection burden, histamine load, or inflammatory instability. A mitochondrial peptide may reveal that the person is underfueled, overtrained, or not sleeping. That is why the person cannot be separated from the response. The response is part of the assessment. Now, this does not mean we romanticize the side effects. We do not say, oh, good, you felt terrible. That means it's working. No, that's stupid and lazy. Sometimes side effects mean stop. Sometimes it means the dose is wrong. Sometimes it means the product is poor quality. Sometimes it means the person is not a candidate. Sometimes it means there is a true adverse reaction. Sometimes it means medical evaluation is needed. Red flags definitely matter. Severe chest pain, shortness of breath, fainting, severe allergic reactions, severe abdominal pain, persistent vomiting, neurologic changes, rapidly worsening symptoms, or anything that feels dangerous should be evaluated medically. But outside of those red flags, many reactions deserve interpretation before dismissal. The most important question is, did the side effect match a known mechanism? Did it match the person's history? Did it reveal a hidden vulnerability? Did it appear after a dose change? Did it improve when the dose was lowered? Did it occur with one product but not another? Did it happen alongside sleep loss, alcohol, illness, stress, fasting, overtraining, or a dietary change? Did it show up in a system that's already struggling? This is how side effects become very useful, not because we ignore them, because we study them. A headache may point toward blood pressure, dehydration, electrolyte imbalances, histamine, sleep disruption, vascular tone, or nervous system sensitivity. Fatigue may point toward undereating, immune activation, poor sleep, low blood sugar, mitochondrial stress, or too much signaling too fast. Anxiety may point toward catecholamine sensitivity, sleep deprivation, thyroid patterns, stimulant load, trauma physiology, or autonomic overactivation. Itching or flushing may point towards mast cells, histamine, immune reactivity, uh, inflammatory load. Nausea may point towards gastric emptying, vasal signaling, bile, meal size, medication interactions, or dose escalation. Mood changes may point towards dopamine, serotonin, inflammation, sleep, hormone signaling, or stress load. Menstrual changes may point towards reproductive axis signaling, insulin resistance, inflammation, stress, thyroid, histamine, or the body shifting out of a stuck pattern. That last one matters. Sometimes a body presentation changes in a way that looks surprising, but clinically, it may reveal a deeper pattern. For example, in women with PCOS type patterns, changes in inflammation, insulin signaling, histamine biology, stress physiology, or reproductive axis tone can sometimes reveal themselves through menstrual changes. That does not mean we jump to conclusions, but we also should not ignore it. A menstrual change is not random noise. It may be endocrine information, immune information, metabolic information, histamine information, a signal that the system is moving. The key interpretation: what changed? When did it change? What peptide was introduced? What dose? What timing? What else changed with it? What symptoms improved? What symptoms worsened? What system does this point towards? And what decision does it change? That is why I tell people and clinicians, do not only track benefits, track responses, track side effects, track timing, track patterns, because sometimes the side effect is the thing that tells you what the real pattern is. Maybe the plan needs to slow down. Maybe the dose needs to change. Maybe the sequence is wrong. Maybe gut and histamine support need to come before a repair peptide. Maybe sleep and autonomic balance need to come before cognitive peptides. Maybe insulin resistance needs to be addressed before hormone axis peptides. Maybe the person needs labs. Maybe they need a different clinician. Maybe they need to stop. Maybe they need to monitor. That is clinical reasoning, not fear, not hype. Reasoning. The mistake is treating peptides like isolated tools. This peptide does this. This peptide is for that. This peptide equals this outcome. But the body doesn't work that way. The body is a network. A peptide signal enters that network, and the response tells you something about the network. That is why side effects definitely matter. They're not just inconveniences. They're not just failures. They're not always danger. And they're definitely not something to dismiss. They are feedback. The Praxis lens here is simple. Respect side effects. Interpret side effects. Do not panic over every symptom. Do not ignore meaningful reactions. Do not force the body through warning signs. And do not assume the protocol is right just because the peptide is popular. A side effect may be the body saying, wrong dose, wrong timing, wrong sequence, wrong patient, wrong product, wrong assumption.